Hello, my name is Jennifer Gomez. I'm doing this topic for 4502, Leadership and Management. The topic I'm talking about today will be the Quality Improvement Initiative. The Quality Improvement Initiative in care, in which I chose and why I think it's important, is the startup of a walk-in clinic at our current clinic right now. Currently, I work for a primary care clinic, which is actually the same thing as internal medicine clinic, and we do not have a walk-in clinic right now to address patient care, urgent care issues. So for instance, if they have something as simple as a cold or a sinus infection right now, they're directed to the ER as well. We're trying to develop where the physicians will have 2 open slots a day for acute issues or urgent care issues. So let's say a patient does come in and need to see the doctor for a cold or a sinus or paperwork or something like that. They would be able to get the same day appointment with the physician, and that would be 2 open slots as well. So it's the walk-in clinic and then also those 2 acute issue appointments as well. The evidence that was used to determine this quality improvement was actually this healthcare questionnaire. It's called the Healthcare Questionnaire Experience. And what it is it's mailed out to the patient after they've seen the doctor just for primary care or an annual or a follow-up appointment with the doctor. It's mailed out to them, and it's a list of 12 questions that they answer. And one of the highest, not patient satisfaction ones that we got back was we got high scores, which is not good. High scores not good. 47% of patients' dissatisfaction was getting questions answered, getting medical advice in between scheduled appointments. So they weren't able to get, patients were dissatisfied. So that means that they weren't able to come in and get appointments. Let's say if they have a 6-month appointment and they get sick during that time, they were having trouble coming in to see their doctor, for care as well. So this is one of the initiatives that we're trying to propose is establishing a walk-in clinic, so that way our scores can go down and patients are happy. And the way it is the questionnaire is filled out by the patient. It's mailed to them, they fill it out, they mail it back, and then it's analyzed by what's called the VA Query program, and then it's translated in by the Haskell scale, and the Haskell scale is the one that determined the percentage. And like I said, we were 47% patient dissatisfaction on patients able to get acute appointments for urgent care issues. So what this initiative is trying to achieve is to improve the patient satisfaction in seeing the urgent care needs that are met, which would eliminate unneeded trips to the emergency room, which in turn would help decrease the cost of emergency room visits. So this would also help because it'll bring down the cost. It'll eliminate as many patients going to the ER for issues that they shouldn't even be going to the ER for. The national standards that are being met by addressing this issue are the improvement performance, to promote a positive culture of service, to advance healthcare innovation for veterans in the country, and to increase operational effectiveness and accountability. The quality indicators that were used to improve this are the quality indicators that are being used to improve this initiative are the rapidly translated research findings and evidence-based treatments in the clinical practice, and also increased impact in VA research findings as well, through bi-directional partnership, rigorous evaluation and communication, and also to continue to make the VA a national leader in promoting a learning healthcare organization through innovation and implementation science. The quality indicators and how they support the initiative, well, they challenge the VA to improve delivery, internal organization, and governance, and to upgrade systems and enhance access to veterans. Right now, veterans, they don't have easy access to their PCP, so this would help them get easy access for urgent care issues, which they know they don't need to be in the ER for. So if we establish this walk-in clinic, that'll help, satisfy patient satisfaction, which is the veterans, and that's the number one goal, is to improve our patient satisfaction. All the people who will be collecting the data, or the personnel involved in the data collection, are of course the nursing staff, the clerks, the physicians, and also the outside representatives who obtain the data, which is the VA query program as well. The agency in which the VA reports their information to is the VA query. They're the ones that, get all the questionnaires back, they analyze them, and then we get them back with the hassle scale, and then that's how they rate the percentage as well. The nursing involvement in helping with this initiative is a big part of this. They see the most and give suggestions on how to improve the initiative, which is the walk-in clinic. The nursing staff are also the first line of patient satisfaction. They are the key part of assisting with the process of successful, the nursing staff are the first line of patient satisfaction. They are the key part of assisting with the process of a successful walk-in clinic. Who else is involved in this multidisciplinary role? In order to have a successful initiative, nurses can't do it alone. So it takes a multidisciplinary collaboration, which entails the clerks and the physicians. It entails a whole group of us. Clerks are the first line of patients going to walk up to, and then after that, the clerks are going to decide, hey, this patient needs to be seen, and then they'll go to the nurses, and then from there, the nurses will talk to the physicians. That way, when a walk-in comes in, it's an easy transition, and then we have those acute appointments, 2 slots a day where we can fill in the patient if the nurse decides, hey, they do need to be seen, or maybe they do need to go to the ER. Some challenges the workplace faces in meeting the goals. With change, of course, there's some resistance maybe faced with the medical staff, the nursing staff, the clerks, the physicians. Physicians are going to have scheduled patients for the day, so having to see an unscheduled walk-in patient for the day, the patient might feel overwhelmed. And then having the multidisciplinary staff collaboration, the new process will be a challenge as well, because just like with any change, it's going to take some time. The nurse can alleviate some of these challenges by showing the differences in keeping an upbeat attitude. Communication, explaining the initiative is to improve patient care to all multidisciplinary team members and to decrease the numbers regarding the questionnaire, because right now we're at 47%, that's high, so we want to bring it down. And then being available when any staff needs assistance with patient care as well. Who would need to get involved in order to suggest changes? Well, the staff involved that really need to help out also is the nursing management, of course, nurse managers, and also the CMO, the chief medical officer, and as well as the clerk supervisor. What other departments do to assist with this modification? Share their ideas on the new process and to help enforce the new changes. Involving the other departments with this initiative would involve asking for their direct input, suggestions for the new process, and open communication with all personnel. In establishing the QI, the hope is to accomplish patient care improves and patient satisfaction scores improve as well. What type of budget is there? Well, with the VA, it's a federal government facility, so budget is done every 2 years. That's how it's planned out. So with their budget right now, there is not one discussed. Right now, they just said that we just go ahead, try to get it organized. The only thing kind of expense that we're gonna do is produce brochures, and with these brochures, it's gonna have information that the patient's gonna need, some important numbers, how to sign up for My Healthy Vet. My Healthy Vet is also another way to help with the walk-ins as well, so we're going to highly encourage them to sign up for that. It's a VA website that they have where they can go on there, log on, get a username, password, and then this will be one way that they can talk with their nurses. They would send them a question through a secure message, which is an email. Send them a question, what's going on, if it's a medication refill, if they're having an acute issue, then they'll send us through the email, then we respond back, and then we can get them in same day if they're able to come in that same day, or if not, schedule them a sooner appointment if needed, rather than have them wait till a routine appointment or telling them to go to the ER unless they absolutely need to go to the ER, which of course we're going to have some patients that need to go to the ER. This is going to be a 12-month project. There's going to be weekly meetings from each representative. So there's going to be a representative from the clerks, from the LVNs, from the RNs, and also from the physicians. There's going to be a meeting once a week. Right now it's on Wednesdays from 2 to 3. It's 1 hour. And then they're going to exchange ideas, ask for input, see what changes they need to make, and see how the walk-in clinic is going. And if they need to make any changes or add stuff or just any kind of communication that they have or issues, it's going to be established at that weekly meeting as well. And then there's also going to be a follow-up survey, which is going to be mailed to the patients. They initially get one after their first routine or annual appointment with the physician, and then they'll get another one at 6 months, and then they'll get another one another 6 months, just to see how we're doing. And this is my initiative topic, quality initiative topic. Hopefully, it's in the process. So we'll see in the next 12 months on how we do in our scores based on the Hassel scale to see if they improve. So we'll see. Hopefully they go from 47% to lower, where it's hopefully less than 10%. Thank you and have a good day.